Hello everyone, you're welcome to this video. Today we want to talk to you again about important things about HIV. Were you aware that there are drugs that you can take to prevent yourself from getting HIV from a sexual incident or from a sexual act? That is the topic, our topic today. We want, in the medical terms, we are going to talk about what we call pre-exposure prophylaxis. We usually abbreviate it as PrEP. These are PrEP or pre-exposure prophylaxis are medicines that we give people to prevent them from getting HIV from a sexual act or from an injection drug use. There are people who are injecting drugs, and there are also people who are going for a sexual act while knowing that the person they are going to have sex with has HIV. So we have drugs that can be used to prevent you from accessing HIV. Now, those are quite important. But before I go and talk about the medicine, who are these people who need to be on these drugs? Before you start telling me that, doctor, you're exposing us and so forth. Now, there are category of people who need these drugs. And if you are in that category, please pay attention and they can give you assistance. Now, one are people whose sexual partners have HIV and yet they are not aware of their viral load. Every 6 months you're supposed to do HIV viral load for patients who have HIV. Now, some people do not have those tests regularly. You are not aware, you are a discordant couple, maybe either your husband or your wife has HIV, but you do not know their HIV viral load status. You qualify. We can help you. You can be using the pre-exposure prophylaxis. Now, that is category one. Category two are people who are continuously engaging in risky sexual behavior. These are people who have multiple sexual partners whose HIV status they are not aware about. And I think, honestly speaking, that is majority of the youths in Uganda now. So just sit and pay attention. You have 3 sexual partners, you have 4 sexual partners. In Uganda, many people are in the sexual network. You have this is your girlfriend, but that girl is also a girlfriend of so and so, and you yourself, you are also a boyfriend to another person. So, and you don't know each other. That is why these days partners are not free with the phones of their partners being seen by the other. They are part of those things that they tell you that do not do. Do not check your partner's phone. The reason is because everybody, almost majority of the people are in a relationship who has other visitors from outside. So if you are in that category, you qualify for pre-exposure prophylaxis, especially on if you know that sometimes you are not comfortable using the condom, or you are not comfortable using protection for yourself, then you qualify for pre-exposure prophylaxis. We need to give you medicines prior to you going into those sexual acts. And then the other category of people who qualify for pre-exposure prophylaxis are people who are using drugs that are injected IV. It sounds like we are talking about a movie incident, but there are people using cocaine in Uganda. People are using cocaine, people are addicted to pethidine, people are addicted to some drugs that are injected inside the body. So if you fall in these categories, and then we have our good friends who are commercial sex workers, we are not condemning you or doing whatever. You are part of our community and we want to protect you. So If you fall into those categories, you qualify to use pre-exposure prophylaxis. There are drugs that you can use that can help you to significantly reduce the chances of you getting HIV from your sexual partner. Now, we have these drugs in two forms. We have the oral medications that you can swallow. There are brands that we have in the market in Uganda. I've given it to a number of patients, though I must confess that the patients that get this in Uganda are much fewer than those that are getting it in Juba in South Sudan, where I practiced some time back. But maybe our people are getting more risk. So you need to talk to the doctors so that they can give you access to this medicine if you fall into the categories we talked about. Now, we can give it to you, the oral medication that you can use for some period of time that can protect you. And then recently, we have a new drugs which are injectable. The injectable forms are also there. We have the lenacapavir that has just been approved by the Food and Drug Authority of the US. It is a drug that can be injected once and it can protect you for a duration of 6 months before you inject another. Meaning that in a year, if you are somebody who has a exposure risk, you can inject it twice in a year. But then we also have the other injectable drug that you can inject every month. You need to inject it. So those options are there. And if you are someone who gets into risk, you sometimes go for the commercial sex workers. You share, you are doing drugs, IV, injecting yourself in the muscles with some drugs. Sometimes you don't know the people you are sharing your syringes with. You are someone who has multiple sexual partners. You have many girlfriends and so forth. You may need to use the pre-exposure prophylaxis to protect you from these infections. And they're effective. They control up to 99% risk of you getting infections. So we want to protect you and we want to reduce the risk and burden of HIV. Kindly subscribe to my YouTube channel to have more conversations with me. Also, you can contact us through the contacts below for more information. In case you need these kind of services, we can be able to access the drugs to you. From wherever you are, we can give them to you. Thank you very much. Kindly subscribe.